Imagine your body's automatic control system suddenly going haywire. Things you never think about, like your heartbeat, breathing and digestion, just stop working right. For people with dysautonomia, this is their everyday reality. It's a condition where your autonomic nervous system, which quietly controls your body's basic functions, malfunctions. It affects millions, but it's a hidden struggle and an invisible illness that's not well known by the public, or even by many in the medical field. Some people feel their heart race and get dizzy when they stand up. This is called POTS. Some days are okay, but on others, it's hard to even get out of bed. Many suffer from sleep problems like insomnia, and their tiredness just doesn't go away. Even though they might look healthy on the outside, this condition is called an invisible illness. Friends, family, and even doctors often don't understand how serious their symptoms are. The journey to getting a dysautonomia diagnosis is long and tough. Patients go from one hospital to another with different symptoms, seeing many different specialists. They undergo many tests for heart palpitations, digestion problems, and dizziness, but most tests come back normal, which confuses both the patient and the doctor. The real problem isn't with the organs themselves, but with how signals are sent. Patients are often told it's just anxiety or stress, and they feel like their suffering is ignored. This can really hurt their mental health. When they finally get a diagnosis through the right tests, their suffering is finally recognized as real. Tests like the tilt table test can help diagnose dysautonomia, but even after a diagnosis, treatment still has its limits. The physical pain from dysautonomia is only part of the story. This condition also greatly affects a person's emotional and mental well-being. Living with a chronic illness is naturally stressful, but the unique nature of dysautonomia causes special mental health challenges. The constant uncertainty of how your body will feel each day can lead to high levels of anxiety. People might be scared of sudden symptom flare-ups, making them hesitate to make plans or even leave their homes. This can lead to feeling alone and deepen feelings of loneliness and sadness. There's also a direct physical link between dysautonomia and mental health. For example, the lack of blood flow to the brain, common in conditions like postural orthostatic tachycardia syndrome, POTS, can directly cause feelings of sadness and anxiety. When the brain doesn't get enough oxygen-rich blood, it can affect mood control and thinking skills. So if someone with dysautonomia feels sad, it might not just be a reaction to a tough situation, but a direct result of an underlying physical problem. This shows how deeply connected our mind and body are. The long journey to getting a diagnosis and the frequent dismissal by medical professionals can also be traumatic. Being told that your physical pain is all in your head can lead to a state called medical gaslighting, where patients start to doubt their own perceptions and experiences. This can hurt self-esteem and lead to a deep distrust of the healthcare system. The burden of constantly having to prove you're sick is exhausting. This adds a lot of emotional work on top of already difficult physical symptoms, pushing many people to their breaking point. Ultimately, it's important to build greater understanding and empathy. We need to realize that just because an illness isn't visible doesn't mean it's any less real or serious. For people with dysautonomia, support from family, friends, and the medical community makes a huge difference. The most important first step is to believe someone when they share their struggles. As science continues to advance with treatments like SNEPI, our ability to empathize should also grow. By creating a more supportive environment, we can lighten the huge burden carried by those fighting this hidden daily battle.